Welcome, dear students. Welcome, myself, Dr. JSMLT, again with you in the series of lectures on novel drug delivery systems. So far, we discussed in novel drug delivery system that concept of novel drug delivery systems, okay, and we discussed that what are the advantages of Ndds, what are the limitations there, okay, how they are different from conventional dosage form or the second generation dosage forms. Then we discussed the targeted drug delivery systems, targeted drug delivery, the concept of targeting, passive targeting, active targeting. We studied the approaches of passive and active targeting and studied the apart from the various approaches, what are the levels or types of targeting we study in our previous lecture. And then we discussed polymers which are utmost important with respect to the novel drug delivery. The selection of polymer, types of polymer, their ideal properties, what are the proper, how they can be selected. So please go through the especially the polymers and chalk out the homework which have been assigned to you. Hope you might have gone through the assignment given to you. Okay, so let's start our discussion today on pulmonary drug delivery system. In the first part, we will be discussing the concept of pulmonary drug delivery systems of pharmaceutical aerosols. After completing this module, you will be able to, number one, define the pharmaceutical aerosols or pulmonary drug delivery system, enumerate advantage and limitation of aerosols, enumerate the use of aerosols. As far as the lesson plan is concerned, we will be covering this particular lecture under the heads definition of Pdds, aerosols, advantages, limitations, uses and application of aerosols. Now, aerosols you have seen in your household in many ways. For example, deo sprays are there, room freshener are there, perfume sprays are there, mosquito, cockroach repellent sprays are there. These all are in the form of, you almost use various kind of sprays. You see them. Actually, they are aerosols. But when the active ingredient there, we call them pharmaceutical aerosols. Okay. Then they are called delivery systems because they are delivering the drug. Now from nature, if you see the rainbow, beautiful rainbow. Actually, the rainbow is an aerosol. How? It is a quite stable liquid aerosol. Liquid droplets are there because which are stabilized in the aerosol form. So that's why the rainbow is there. Another example from irrigation, that irrigation fountain when you see, as you can see in this picture, that these are also aerosols. These are coarse, unstable liquid aerosols. No, things are there, but we couldn't identify. We are unable to identify their terminology. Okay, so we are going to clarify you so that you can understand. PDDS, pulmonary drug delivery system. It means which are meant for lungs. Pharmaceutical aerosols. Pharmaceutical aerosols is basically a broad phenomena being used for decades for therapeutic purpose globally for as a pressurized meter dose inhalers, MDIs, dry powder inhalers, nebulizers, skin sprays, painkiller sprays, etc. Even increasing incidence of asthma globally is increasing the demand of aerosol. You know that there are so many asthmatic patients globally, and it is utmost needed for each and every asthmatic patient who is on these sprays. Okay. Now let's define aerosol. Aero, air, sol, solution. They are pressurized packages. Aerosols are suspensions of small solid particles or droplets suspended in a gas or vapor. Good, remember it. Actually, they are the droplets which are suspended in gas or vapor. They are aerosol and they are in pressurized package. Okay. Let's take another definition. Aerosols are the products that depend on the power of a compressed or liquefied gas to expel the content from the container. A container is there, a gas is there which is throwing the active ingredient out of that package. Okay, so this is called aerosol. Pharmaceutical aerosols or pulmonary drug release systems, they are products that are packaged under pressure and contain therapeutically active ingredient, as we have discussed earlier, that active ingredient or API, active pharmaceutical ingredient, is needed there if you want to call it a pharmaceutical aerosol, and that are released upon activation of an appropriate valve system. A valve system is there which is to be activated for delivering the drug. So this is called pharmaceutical aerosol. They are intended for mm, apart from pulmonary delivery, topical application to the skin, local application into the nose and other body cavities like mouth, lungs. So they may be nasal aerosols, lingual aerosols, inhalational aerosols. So there might be several types of aerosols. These products may be fitted with valves enabling either continuous or metered dose delivery, hence the term metered topical aerosols or metered nasal aerosol, etc., as USP defines it. Okay, this is the USP definition of metered topical aerosol and metered nasal aerosol. Okay, now question is the problem area is how to learn the definition. For example, you forgot your verbatim definition. Now, what is needed? First, it is a pharmaceutical aerosol. So, first thing would be active drug will be there. It is utmost important. API will be there. Second thing, where the API is. API is dissolved or suspended or emulsified in propellant. Okay. To release the drug in the form of mist or spray. The drug will be released in the form of mist or spray. To topical, where? And now where it will be delivered? The next question is topical, nasal, oral, pulmonary and other body cavities for local as well as systemic therapeutic uses. It may have the local use, it may have the systemic use. Okay. So API, where it is, in which form it is there, dissolved, suspended or emulsified, in which form it is being delivered, mist or spray, and where it is being delivered, the nasal, oral, pulmonary and other body cavities. So these four things you have to learn when you are defining the pharmaceutical aerosols. Okay. Now advantages of aerosols. We will enumerate the advantages of aerosols. Now first of all, it is easy to administer, portable, easy to administer. You just have to press that valve and it will be delivered. It is portable, you can carry it in your pocket simply. Minimum dose is required because you are delivering directly to the site of action. So a minimum dose is required. Higher dose is not required now, only because only that much drug is needed which is needed for the site of action, which is needed for the therapeutic action. Because there will be no peripheral distribution. So minimum dose is required in this case, and that's why the minimum adverse effects are there, minimum side effects are there, because the drug dosage is reduced when we are using in the form of pharmaceutical aerosol, and the drug is not being distributed to other body parts to elicit any kind of adverse effect. Direct delivery of drug is there to site of action or target area in case of pharmaceutical aerosols, and better spreading is there due to spray mist, because you are delivering it with the spray, with the mist. So the spray will be, that spreading of active pharmaceutical ingredient will be good, will be better as compared to the other dosage forms. And due to these above what we have discussed, that spreading is there, direct delivery is there, quicker onset of action is there, because we are directly delivering to the site of action. Lower irritation as compared to topical application of drug is achieved when you are delivering it in the form of spray. And most important thing is dose to dose maintenance of sterility. It means that when you are taking an ointment from a box, you are disturbing the sterility, you are affecting the sterility. Okay, but when you spraying this thing, the only the dose which is being delivered will come out and the rest of the dose will be sterile enough. Okay, it will be sterile completely. So dose to dose maintenance of sterility is achieved with aerosol package. Better protection for oxygen and or moisture sensitive drugs is achieved with the help of pharmaceutical aerosols. Uh, Better protection after the better protection, it avoids the first pass metabolism because the drug is being delivered directly to the site of action and directly to the directly to the systemic circulation. So the first pass metabolism is completely avoided with the pharmaceutical aerosols. Now let's discuss some of the limitations. Now what are the limitations? Obviously, for very obvious reasons, they are not cost effective. Just compare. You can compare a strip of diclofenac tablet, maybe 10 rupees per strip, okay, containing 10 tablets. While if you purchase the diclospray, that aerosol of diclofenac, same, I think not less than 80 rupees it will be, okay, 60 to 80 rupees minimum, okay, and for a good brand it may be higher. So that's why they are not cost effective. If you are just discussing about the cost, if you will go for the benefit to risk ratio and the advantage, it, it is favorable in the case of aerosols, okay. Proper use is needed to get the effect. No, you need to train that person, you need to train that fellow who is going to take that aerosol, that how to take it properly, because improper use can lead to wrong medication, can lead to underdosing, okay, and can lead to loss of drug. You need to inhale the drug, you need to inhale that pharmaceutical aerosol when you are pressing that valve. This is to be told to the patient, okay, to the person who is using this pharmaceutical aerosol. It is not as simple as it seems. You must need that actual process of taking or administering yourself. Limited safety hazards are there, flammable, pressurized, and it may be inadvertent inhalation. So they may contribute to the safety hazard. Ancillary devices are needed, are required with an MDI meter dose inhaler like holding chambers, spacers. So these are devices which not only increase the cost of the overall drug therapy, but also it is typical to carry them with yourself because the ancillary devices you have to. It is not integral. You'll have to take one part, two part. So it may be some kind of limitation, you can say. So exam point of view, advantages and limitations. Whenever the definition is asked, advantage and limitation is always asked. Okay. So in this way, we can start this discussion. Now, what are the uses of PDDs? This pulmonary drug disease system, pharmaceutical also. They are majorly used in asthma and chronic obstructive pulmonary disease, COPD. MDIs, meter dose inhalers, dry powder inhalers. These are used in majorly in the pulmonary disease. They are also used by used through these various routes other than the pulmonary, like topical, nasal, ocular, oral, rectal, and vaginal routes. Now let's take one by one these different aerosols, oral and lingual aerosols. It provides easy access to hard to reach sites. Number one. In general, we cannot reach there. But yes, we can reach with the help of oral and lingual aerosols. Easy access to systemic circulation is achieved with the help of these aerosols. They avoid first pass metabolism as we have discussed, because we are directly delivering to the site of action, and through it is entering to the systemic circulation through the oral mucosa or that high vasculature area. Anti-anginals in emergency like nitroglycerins are delivered through these aerosols. Local anesthetic like lidocaine for dental care, antacids, aluminum and magnesium silicate, antiseptics like chloroseptics are delivered through oral and lingual aerosols. Now taking the topical aerosols now. They are convenient as compared to application. You are taking an ointment and spreading it. The problem will be there. No need. There is first of all no need to touch the skin. It is convenient to spray when you are. You see the sportsmen. The they're whenever they are in pain in the ground, the spray is very much convenient rather than taking any other dosage form or ointment or other things. Okay, and unused product is not contaminated. There is dose to dose maintenance of sterility, as we have discussed in earlier slide also, that dose to dose maintenance of sterility is the very nice advantage of pharmaceutical aerosols. Spray on bandages and antifungal sprays like miconazole are the examples of topical aerosols, and antibacterials, neomycin, wound washing, rubiferin like methyl salicylate, anti-inflammatory steroids, dexamethasone, local anesthetics, benzocaine, etc. So these are the examples. Whenever the in the exam you are writing, don't skip the examples, drug example, therapeutic category and their example. Even if it is not asked, if it is a 5 mark question or 10 mark question, you are asked definition, advantage or application part, then you must give the examples, okay, for every category. Vaginal aerosols. It provides easy access, expand to fill available space. In the available space, it can expand, spreading is good. So the aerosols serve the purpose in far better way as compared to other conventional dosage forms. It provides complete surface coverage, and examples include contraceptive foams like nonoxynol 9. Now moving to the rectal aerosols. Like the vaginal aerosols, rectal aerosols provide the easy access of API to the rectal cavity, and it can expand to the fill available space due to good spreading of API in the form of spray and mist. It provides complete surface coverage. Examples, you can say the anti-inflammatory steroids, hydrocortisone, local anesthetics. In the anti-inflammatory steroid, hydrocortisone are there. In local anesthetic, primoxine are there. Okay, so moving to nasal aerosols. As the name suggests, they are delivered in the nasal cavity. Easy access is given by the pharmaceutical aerosols rather than any other dosage form. Like, say for example, in the nasal drops, what are the limitations there? It is rather inconvenient to take. Number one. Number two, loss will be there. Number three, dripping will be there. So minimal dripping is here in the nasal aerosols. Examples of these categories are decongestants like phenylephrine, anti-allergics like cromolyn sodium can be given through the nasal aerosols. Anti-inflammatory steroids like beclomethasone, anti-smoking agents like nicotine, moisturizers like normal saline. Systemic access of antidiuretics can also be done, like for example desmopressin. These can be given through the nasal aerosols. So these are the aerosols, and you will have to, as we have mentioned, that in each and every category you must mention the examples with category and the drug. Don't forget this thing. Ocular aerosols, as the name suggests, they are applied on the they are used for the ocular purposes. It may be just for cleansing the lens, but they are not applied to the eye. They are used for cleansing the lens, because we can't touch that lens, okay, that lens which we are wearing. So you just need the spray. So easy access, minimal dripping is there, and contact lens clearing solution are made as ocular aerosols. Respiratory aerosols, as we have discussed, we will be dealing it in quite detail in a particular module, which we will be going to discuss in next lecture, or maybe another lectures in this series itself. Local as well as systemic action is obtained when you are doing the respiratory aerosols, when you are taking it in respiratory aerosols. As you can see in this figure, this is the device which is called the respiratory aerosol. It may be various types. We will be discussing it. And asthmatic patient take the drug through this directly to their bronchi. So anti-inflammatory steroids, beclomethasone, anti-allergics, cromolyn sodium, antivirals, ribavirin, bronchodilators, albuterol, migraine, in the case of migraine, ergotamine tartrate, smoking cessation for nicotine. So these categories, in these categories, therapeutic categories, the aerosols are used, respiratory aerosols are used. Now these are the references. Please go through the pulmonary drug release systems concept from the references. However, there are so many references which are very good for delivering this, specifically the pharmaceutical aerosols. Now let me summarize this, whatever we have discussed in this introductory part of the pulmonary drug release systems. Aerosols, pharmaceutical aerosols are pressurized package. Pulmonary drug relief system is a specific part of pharmaceutical aerosol which is intended for only for pulmonary area, but actually the aerosols are used for various routes of administration, okay, like rectal, vaginal, topical. In the aerosols, drug is API is there, propellant is there, it is dissolved, suspended or emulsified in propellant and dispensed in the form of mist or spray. Okay, that delivery API is there, propellant is there, that delivery form is there, and this pressurized package system is there. So it defines the pharmaceutical aerosol in this way. What are the advantages? That low dose, quick onset of action, high bioavailability, low adverse effects, avoiding first pass metabolism, dose to dose maintenance of sterility, easy access, good spreading and into this available space. All these make the pharmaceutical aerosols very very beneficial for a good number of therapeutic ailments. Okay, however, there are some limitations that they are not cost effective and some safety hazards may be there, some training is needed there. But overall, pharmaceutical aerosols are revolutionary products and pressurized package system for delivering their drugs. We'll be discussing the further aspects of pharmaceutical aerosols in our next lecture. Meanwhile, please remember these definitions along with the examples of all kind of aerosols. Thank you. Thank you for being with us. Happy learning.